Hi, my name is Brianna Vargas Koya, and this is my Advanced Concepts Presentation 7 for Biochemistry 1. Thank you. For this next discussion post, we are going to be talking about vastatin, which is a high cholesterol and blood pressure medication, and it can treat high cholesterol as well as triglyceride levels, and this may reduce the risk of heart attack, stroke, and blood vessel problems. And I thought it was important to just include this photo just to see what we in our modern society, what we always see when we type in medications and the basics on Google, and just to see what information is out for the general public. So anyway, to continue on, lovastatin is a cholesterol-lowering medication called a statin, prescribed to treat elevated blood cholesterol levels. Mevacor is available in generic form. Mevacor should be used in addition to dietary modifications as part of a treatment plan to lower cholesterol levels when the response to diet and other non-pharmacological measures alone have been inadequate to reduce our cardiovascular risks. Side effects of Mevacor are uncommon and typically short-term and include headache, muscle pain, tenderness, weakness, joint pain, back pain, stomach pain, gas, bloating, stomach upset, heartburn, indigestion, nausea, constipation, diarrhea, or sleep problems, insomnia. As mentioned, lovastatin is used along with the proper diet to help lower the bad cholesterol and fats such as LDS and triglycerides, and it raises the good cholesterol, HDL, in the blood. It belongs to a group of drugs known as statins, as we mentioned before, as it works by reducing the amount of cholesterol made by the liver, lowering bad cholesterol and triglycerides, and raising good cholesterol. It decreases the risk of heart disease and helps prevent stroke and heart attacks. In addition to eating a proper diet, such as a low cholesterol, low fat diet, other lifestyle changes that may help this medication work better include exercising, losing weight if you're overweight, and stop smoking. Consulting a doctor is much more important and sufficient, as we mentioned in the previous discussion and the other last week's advanced concepts. Heart medication is very important, as we need to control the homeostasis. And with that, many people like to take, for example, like we mentioned, the Bayer, without knowing the common side effects. And just because one person takes it does not mean that it will be good for that person. So therefore, definitely it needs to be followed through, especially with a prescription and a high dose of this type of medication. Continuing on, we want to know how it works. Lovastatin works by blocking an enzyme in the liver known as HMG-CoA reductase that is responsible for the conversion of this HMG-CoA to malonate, an important substance necessary for the synthesis of cholesterol and coenzyme Q10. Lovastatin also boosts the breakdown of lipids. It also belongs to a group, as I mentioned before, known as HMG-CoA reductase inhibitors, and it may also be called a statin. In continuation on how lovastatin works, lovastatin is converted to its active form after oral administration. The peak levels are seen within 2 hours following administration. With that includes proper administration. If you are not taking the medication properly, therefore the effects will not be as directed and as wanted. However, it may take 1 to 2 weeks of regular dosing before improvements in your cholesterol levels are seen, and up to 4 weeks before the maximal cholesterol-lowering effects of lovastatin are apparent, as I mentioned. Lowers LDLS cholesterol and L-protein B. This is one of the main effects of taking this medication, and secondary reasons for abnormality, high cholesterol levels. This is one of the reasons why one would be taking this medication constantly and for a longer period of time. And it can also impact uncontrolled diabetes, as well as low thyroid levels, alcoholism, and liver disease, and therefore it should be ruled out before starting this type of medication. Overall, to conclude this advanced concepts presentation for this week, it is important to understand the benefits of blood pressure control, as blood pressure and cholesterol go hand in hand and they have a strong direct relationship. Only about half of the people with high blood pressure have their condition under control, and with that, this is a very serious public health issue that we talk about all the time. People have heart problems, heart conditions, family history, and there's often many people do not do much to improve their chances of having these conditions, and they're often okay with living with the conditions. However, the significance of diet and heart disease will help in promoting the blood pressure as well as the cholesterol along with this medication. And with that, a healthy diet does bring a lot of big benefits, as well as with an unhealthy diet comes the cardiovascular diseases, including the increase in blood pressure, increase in sugar levels. However, with controlling the foods for the heart, improving that, fruits, vegetables, and other heart-healthy foods, this will help with the promotion of a normal and healthy blood pressure as well as cholesterol.